Good afternoon, and welcome to our fifth lunchtime conversation as part of our 55 and Better Virtual Expo, brought to you by the Loveland Reporter Herald and the Greeley Tribune. My name is Al Manzi. I'm president and CEO for Prairie Mountain Media and publisher for the Reporter Herald and the Greeley Tribune. Today's session is entitled Hospice 101, When Is It Time? Debunking Myths and Misconceptions. I'm joined today by Joyce Bulman, Senior Director, Hospice and Palliative Care, and Dr. Cara Johnson, physician with Hospice and Palliative Care with Banner Health. Immediately following today's session, I'll host a Q&A session, as we always do. So please feel free to enter your questions anytime during the session, and we'll get to them in good time. So please join me in welcoming our two presenters, and Joyce, I believe, is going to lead us off. Joyce?
Thank you, Al. I appreciate it. Welcome, everyone. Appreciate you joining us today as we talk about hospice services. We have a lot of information to share with you, and I'm looking forward to answering any questions that you have at the end. So we will go ahead and get started with our presentation. So we are part of, we are Banner Hospice. We are part of the Banner Health System, which serves Northern Colorado with multiple hospitals. Again, my name is Joyce Bulman. I'm the Senior Operations Director for Hospice and Palliative Care. And Banner Hospice is part of a bigger consortium called Banner Health Advanced Illness Resources. And we have Banner Hospice in the Arizona area, Banner Hospice of Northern Colorado, Banner Palliative Care, and then the Banner Caring Bridge. Our leadership team that serves Northern Colorado includes Dr. Sarah Payne, who is our Divisional Medical Director, Pam Roman, who's our Clinical Director, Mary Goldenberg, who's our Primary Practice Manager for our Palliative Care Program, Dr. Johnson, who you'll be hearing from shortly, who serves as our Medical Director for both Palliative and for our Hospice program, and then Lisa Rigg, who is our Services Director in Northern Colorado. So starting out with what is hospice? Hospice is primarily a concept of care, not a specific place of care. Medicare created the hospice benefit back in the early 1980s as a way to provide support and care, not only for patients who were at end of life, but also for their caregivers and family members. It is meant to be a benefit that's provided in the patient's home, and that home can be wherever the patient calls home, whether it's their private residence, an assisted living, group home, skilled nursing facility. It really is primarily care that is provided in the home setting. The emphasis is on palliative rather than curative care. And what that means is rather than still continuing to seek aggressive treatment to cure a disease process, we turn our focus onto palliative care, which really revolves around symptom management and quality of life as opposed to the curative. Symptoms are managed through professional medical care. Patients that elect the hospice benefit are supported by a strong clinical team with medical directors, nurse practitioners, seasoned registered nurses, LPNs, and CNAs. So you have a whole group and team that is caring for you and really managing all of your symptoms. And what we refer to that as the interdisciplinary team. It's really a unique concept of hospice where we really take all of our services and we surround you with those, but we're also having ongoing conversations. So if the CNA is in the home and sees something, she's reporting that back to the registered nurse, who's then reporting that up to our nurse practitioner or our medical director. And one of the unique things about the interdisciplinary team is that for hospice, it includes the patient and the family and the caregiver. And I'm going to show you a diagram next about what that looks like, but it really puts patient and family at the center of the care. We always say that our patients are the one driving our care, and we want to make sure that each experience is a unique experience and that we're meeting individual needs. We also provide emotional, spiritual, and practical support based on the family's wishes or the patient's wishes and the family's needs. So we have social work availability, we have chaplains to come out and visit, and really just looking at any of those end-of-life conversations, any of those end-of-life decisions that still need to be made, really providing the patient and the family with all of that support. Another unique advantage of hospice services is our trained volunteers. So we know that being a caregiver can be challenging at times, and our caregivers often need breaks in their day so that they can keep their batteries charged. And so our volunteers can offer respite care for family members. So if a caregiver needs to run out and has an appointment or just wants to grab coffee with a friend, we have trained volunteers that will come into the home, sit with the patient, interact with the patient, and provide that respite. And our volunteer program is very robust. Of course, with COVID, we've had to change a bit how we provide our volunteer services, but we still continue to provide those services, even despite the COVID pandemic. So talking about our interdisciplinary care model, really looking at, again, the patient and family is in the middle of that care model, and we have everyone else surrounding them, making sure that we're meeting all of the needs and addressing any specific concerns that the patient may have. We create a care plan, which is created with input from all of the interdisciplinary members. And that care plan is reviewed every 2 weeks because we know that things can change. What might be important early on in a hospice stay will definitely change as the patient progresses closer to death. And so we want to make sure that we are continuing to update that plan of care, make sure that it's timely, and that the patient and family understand what the care plan is. Our visit frequency for all of our different clinicians is really individualized as well. We want to make sure that we are providing the right level of care at the right time. On average, we typically send our registered nurses out twice a week. CNAs will go out twice a week as well. But again, if the patient or family have increased needs, we will adjust that visit frequency. Or if they say, you know what, we're doing okay now, then we can also step back a bit as well, while continuing to support everyone. Another important piece of this is bereavement counseling, and we're going to talk a little bit more about that in a bit. But really, the bereavement counseling is there for pre-death as well as post-death. It's really about supporting the family. But if there are identified issues prior or some special circumstances, such as young children in the home, some complicated grief, our bereavement counselors will get involved while the patient still is living, to help smooth over some of those concerns and deal with some of those complicated grief issues. So when is it appropriate to consider hospice? And this is the million-dollar question. Oftentimes there's a misnomer out there that hospice is only for in the last days or weeks of life. And if you go back and look how Medicare set up the Medicare hospice benefit, it really is for those last 6 months of life. And what we find is that patients and families get the most benefit from hospice when they're able to really have that longer length of stay on hospice services. Doesn't mean that someone that gets a diagnosis and is progressing quickly doesn't benefit, but there really is added benefit in coming onto hospice sooner than later. Some of the points to think about when it's time to consider hospice is a prognosis of 6 months or less. That is kind of our defining factor on whether a patient is appropriate for hospice or not. And none of us have a magic ball to determine when a patient has 6 months or less. And so we really have a conversation with the primary care physician about, would it surprise you if this patient passed in the next 6 months? And if their answer is no, that it would not surprise me, then that meets the criteria for the 6 months or less. Doesn't mean that patients can only be on hospice for 6 months. What it means is we will continue to reevaluate. Oftentimes, we will get involved with the patient and family earlier. We're able to really manage those symptoms, come up with some different medications to help control that, really look at the medications that are being taken in regards to interactions with other medications. And sometimes our patients graduate off of service, and we celebrate that. And then other times we have patients that are on for longer than 6 months. And so again, that is just a starting point for the conversation. Another time to think about hospice is when the treatments are no longer working, or they're really causing more pain and discomfort. Again, hospice is about quality of life, not quantity of life. And so if you or a loved one find yourself in a situation where you're continuing to do treatments after treatments, and it's really affecting your quality of life, and there really isn't any benefit from doing that, or it's causing more pain and discomfort, that's a great time to reach out to hospice and talk about what services we can offer. Serious pain or other symptoms that are difficult to manage, such as continued weight loss, severe fatigue, difficulty with daily personal cares, difficulty breathing or swallowing. Those are also good times to reach out to hospice and have an assessment completed to see where can we intervene on those different items. Hospice has a plethora of tools to use to really help with managing symptoms so that you can have the highest quality of life. Focus of care has changed from curative care to quality of life. Talked a little bit about that already, but if you're having a conversation with your specialist or your primary care physician, and the conversation is more about, we've done what we can, or future treatments are not going to prove to be beneficial, again, that is a great time to reach out to hospice. Last but not least is that family members and caregivers are beginning to feel overwhelmed, either emotionally or physically, by providing daily care. Again, we talked about the caregiver burnout that can occur, and so hospice is there to partner with our caregiver, with the caregivers that are in the home, and really look at how we can support them so that they can best support the patient. So the hospice Medicare benefit has 4 levels of hospice care. We were not going to get too much into these, but the 4 levels of care are identified to really meet the differing needs of caregivers and patients. So these levels include routine care, which is the majority of the care that we provide. This is in the home setting. And these are those twice-a-week visits and by our nurses, and all of the other visits from the interdisciplinary care. Sometimes our patients develop symptoms that cannot be managed adequately in the home, and they require something that's called general inpatient care. This is care that's provided in a skilled nursing facility. It can either be in a hospice inpatient unit, it can be through contract with a skilled nursing facility, and we also provide this level of care within our banner hospitals. And this is really a short-term benefit to have the patient come in. We will try different medications, try different interventions to get the symptoms back under control so that the patient's comfortable, and then we would return them to routine home care. One other level of care, the 3rd level of care, is continuous care. This is very similar to general inpatient care, but we provide that care in the home setting. So we'll have staff that are in the home. Again, this is short-term, more of a symptom exacerbation that we would then provide nursing and CNAs to come into the home. Typically, this is about a day and a half until we're able to get symptoms under control, and then we would then return to routine home care. The last benefit, which is one of my favorite benefits, is the respite care. And again, this is to respite the caregiver. So we have contracts with facilities around your communities where you can go in. It's typically for 5 days. And it allows your caregiver to get away, go on vacation, maybe take care of some of their own medical needs while you're in a safe and secure environment, still being cared for by the hospice team. So the primary goal of treatment is really in the early, middle, late, and end stages to enhance quality of life, maximize functional performance by improving or stabilizing cognition, mood, and behavior. And that's a lot of big words to really talk about. Our primary goal of treatment is your comfort, that you feel supported, and that we are supporting those around you. So what are the benefits to my family if I elect to receive hospice services? There are several. I think first and foremost, just that expert end-of-life symptom management. Hospice is, this is our specialty, is making sure that we're managing symptoms. End-of-life education and support. Oftentimes this can be a very scary time, not only for patients and families. And so we really emphasize the education on what to expect, how can we best support you, and how can we prepare you for what is going to happen at end of life as best we can. Again, that interdisciplinary team approach, which really gets all of your caregivers around a table talking about what is best for you and sharing what their perceptions are. And so you have everyone working towards those goals of comfort and dignity at end of life. 24/7, 365 support at any time of the day, any day of the week. You can pick up a phone and you can be talking with someone, with one of our hospice RNs. This is a great benefit, especially if something occurs quickly and you're not quite sure and you don't know when, your nurse may not be coming out to the next day. You can always pick up the phone and we will talk with you and walk you through what we can do from remote. And if needed, we will send one of our nurses out to visit and evaluate the situation. One of the goals of hospice is really not going to the hospital anymore. And so this allows you that support and that care model that will help support you in your home and not require you to go to the hospital, because nobody likes to go to the hospital. We really focus on quality of life, making sure that whatever's important to the patient is where we're focusing. We've done things such as we've completed marriages, weddings within patients' home. We have, made sure that family members have been able to come in and see the patient. Just a lot of things, and that's really individualized to what is important to you as the patient. Caregiver support, I talked about that already. Just a great benefit to support those that are caring for end-of-life patients. And then our bereavement service program, which is a 13-month program after the time of death. And that includes mailings, it includes telephone calls, and it also includes group therapies. So lots of great benefits from bringing on hospice services. So let's get to the misunderstandings about hospice care. This is always one of my favorite places to talk. So hospice is only for the last days and weeks of life. It is not. As I said before, it is meant to be a 6-month benefit or longer if needed. And really, there are many additional benefits to coming onto hospice sooner rather than later. And I will tell you, in my 15 years of hospice, I've never had a family tell me that they wish they would have waited. What I've heard from them is they wish they would have called earlier. And one of the nice things about bringing in hospice is that it allows the caregiver then to kind of resume into the role that they were already serving. So for example, I had a nurse tell me once that once she brought hospice in, she was then able to be the daughter again, and not the only medical person in the room, and really got to just enjoy those last months with her mother, by being the daughter and knowing that everything that was medical was taken care of. Another misconception is I'll have to stop my medications if I enroll in hospice. Again, not true. One of the things that we do at the time of admission, we take a comprehensive look at all of your medications, to make sure that are they still appropriate. Oftentimes there's medications that you are taking, that when you elect hospice may not be as important. And we all know that every medication that you take interacts with other medications. And oftentimes, because we can simplify your medications, you'll start feeling better. We see this quite often. And then another piece of the hospice Medicare benefit is that any medications that are related to the terminal diagnosis are covered by your hospice benefit. So we will then become your provider of all of those medications, and we work with local pharmacies to have those meds delivered. So no, you don't have to stop your medications. We will look at those, and in a conjunction with you, talk about what is best for you where you're at right now. I won't be able to continue to see my primary care physician if I enroll in hospice. This is absolutely false. In fact, we encourage you to continue to have a relationship with your primary care physician. Oftentimes, your PCP will serve as your attending physician on hospice, in conjunction with the hospice medical director. If you don't have a primary care physician, or your physician says, you know what, I trust hospice to oversee the plan of care, our hospice medical director will provide those attending physician services, but we'll continue to communicate with your primary care physician if you choose, to let them know how you're doing, how are things going, because they are an important part of your medical history, and we certainly want to keep them engaged if that is your choice. I can't come off of hospice once I enroll. Again, we do have patients that graduate off of hospice. We also have patients that say, you know what, I've heard about this new treatment. I've heard about, I had conversations with my family and they want me to try, one more time. We absolutely support patients who choose to, seek aggressive treatment. And so if that's where you come to in your time on hospice, all you need to do is let us know, and we will discharge you from hospice. You'll go right back to your primary care specialist, and then we will be here if and when you ever need us again. Hospice care is expensive. So the Medicare hospice benefit actually covers 100% of hospice care. This includes medications, any supplies you might need, any durable medical equipment that you may need in the home, and then also covers all of the nursing visits, physician visits, CNA visits, everyone that comes to you from our interdisciplinary care team, that is covered 100% by Medicare. If you have a commercial insurance, each commercial insurance has their own hospice benefit, but oftentimes that is covered at 100% as well. And so we will, when you call for a referral, we'll find out what your insurance is. If it's not Medicare, then we will find out for you what your benefit covers. How do I get a referral to Banner Hospice? It's actually very easy, and you can be referred in a multitude of ways. Your primary care physician can refer you, your specialist can refer you, and you can also self-referral or family refer you. So if you're not connected with a primary care physician or a specialist, and you think, it might be time for me to come on to hospice, all you have to do is reach out to us at the number listed here, and we'll have a registered nurse come out and assess you for eligibility, and talk with you about the options and admit if appropriate. So we have our telephone number on this slide. We also have our website, which you can also go to get more information, and you can also request a referral at that time. So at this time, I'm going to turn this over to Dr. Johnson, who's going to talk with you about more of the benefits of hospice care.
Thank you, Joyce, and thank you to all of you who are spending your lunch hour with us today. We're thrilled to be here to talk to you and help answer questions to help demystify the process of enrollment into hospice and to answer your questions about what is it about. So I'm Dr. Johnson. I am a geriatrician by trade and have spent many years taking care of older adults who are coming to their twilight years. And so this is a very personal and passionate calling for me, and it's just an honor to be working with this community here. The first thing I'm going to do is review Banner's five keys of hospice care. I think one of the misconceptions that we have is that when someone enrolls into hospice care, that they're kind of just then let loose and there's not a lot of direction. So what we really try to do with all of our participants is to sit down and come up with this five-pronged approach to really help stay ahead of things so that families can provide the best level of care at home and that our participants are well taken care of. So these five keys encompass crisis plans, comfort, follow-up, education, and care planning. Crisis plans generally are a guideline of what to do if we start seeing a symptom. We know that several chronic illnesses, as they reach the end point, start to show things differently. They start to affect people in different ways. So, for example, if you have end-stage COPD or emphysema, you may start having more shortness of breath. What we would do is develop a plan that if you started feeling those, start feeling short of breath, that this is how we're going to proceed. And so that way you get to be empowered and be a part of that care process. So we kind of help you and your family come up with kind of some guidelines and a roadmap to help guide you on those symptoms. We also look at comfort, which is looking at different medications to manage different symptoms. Again, so for shortness of breath, we have medications that help with that. We want to make sure that you're not having any upset stomach or nausea, pain, things like that. So we're going to look at your meds, but we're also too going to look at any sort of roadblocks that may prevent a patient from receiving their maximum benefit. So if there's concerns about a medication, I'm afraid that it may do this. We're going to help you with all of that and talk about it and make you part of that team. Follow up, all of our nursing staff, our CNAs, myself, if we come and visit. At the end of the visit, we're going to kind of review everything that we've gone over during that visit to make sure that we've been good at our job of communicating to you kind of what the game plan will be, to see if you have questions and to follow up on those, and to make sure that participants and their families have the supplies and the support that they need. Education is another big part of what we do. We're going to sit down and talk with every participant about and their family about what to expect. I think that as we have progressed as a society, the dying, just to be blunt, dying is very mystifying. In the beginning of the 19th century, 20th century, people passed away in their homes and they passed away with their families around them. And as we have become more mobile and technologically advanced, a lot of that has moved from the home to other locations, and a lot of people have not witnessed that. So we're going to help explain the things to expect. We're going to explain symptoms to look out for. We're going to just make sure that everybody has the information they need to be part of that team. We also look at care planning as well. So we have a social worker and a team that will help navigate things like advanced directives, or if someone needs help doing a medical power of attorney. We're just going to help people with those more formal aspects of care, so that they are comfortable with that and that they've got that in place. What we really try to commit to with all of our participants is to provide the best care possible, care that we as individuals would want to see our loved ones receive. So you get, or any participant would get expertise in pain management, symptom control. There's always a nurse available. I think Joyce touched on a lot of these things, but a nurse available 24 hours a day. So if there's something that comes up in the middle of the night, you call us, we have someone who's going to answer that phone, and we're going to come up, we're going to go from there and help anybody through that. Again, medical social worker, we have a chaplaincy, which is lovely. There's a lot of people, their spirituality means a lot to them. And so we are honored to help people with that support. We have CNAs, we have trained volunteers. We really like to focus on the entire family. So this is it. The participant and their family are part of our team, and we are part of your team. And so we're going to support everybody with our social worker, with our bereavement counselor. Again, more guidance to cope with illness and prepare for loss. I think even if we have a crystal ball that we can say this is the day and the time that your loved one will leave us. Even if we have that, it's hard to prepare for that. So it's steps, it's a lot of things to work through, and we're going to help you, and we're going to give that support to anybody who works with us. And then again, we have individual and group bereavement support in place, which is a big part of hospice care. Again, 24/7 assistance. So for anything that comes up, we also really, if you feel in the middle of the night that maybe it's time, we are available. You can call us and we'll get the ball rolling for you. And we really do try to do same day admissions, meaning if the consult comes through, or if you call us, we're going to try to send somebody out there on the same day. The caveat being that if today doesn't work for you and tomorrow works better, then we're going to do it tomorrow. So really, we really try to get people, get them seen and start that process on their schedule. So again, as Joyce mentioned, I think there's a lot of misconceptions about hospice and end-of-life care. I think this is a lovely graphic that really kind of helps walk us through what one person may go through at end of life. And so who we have here is we have Anna. And Anna has multiple chronic medical conditions. She has congestive heart failure, so her heart's not working anymore to the capacity that it once was. It seems to be declining. We may be in and out of the hospital a little bit more often. And at this point, a lot of Anna's physicians are saying, we think that maybe you are coming to the end of your life. You are entering into the twilight period, and hospice may be a good support for you. And so at first, Anna may be skeptical, because we all hear things about hospice, what it is, what it isn't. And so at first, Anna's kind of like, I don't know, I'm not sure. I thought you had to be really close to death, or once I go into hospice, that means I have to go live someplace else, or I'm not allowed to do anything anymore. But she finds out that, hey, this is a way for her to receive care in her home and spend her remaining time on her terms. So she's excited about that, and she would like to maybe give it a chance, see how it is, because she knows that if it's not working, she can always say, I don't want to do this anymore. So she enrolls, the team comes out and they talk with her. One of the big goals is she has a grandson who's going to get married in 2 months, and she really wants to be at that wedding. She promised, she's very close to this grandson. And she tells this to her care team. And so her care team is going to do everything it can to really help that dream come true for Anna. If that means that it's here in town, we're going to kind of try to do some things to help prepare, to kind of help keep her doing well so she can go. Or maybe if it's out of state, we're going to make sure she's got the medications. What support can we give? Does she have enough oxygen to make that trip? So her care team is going to help her try to do this thing because it's important to her. Eventually, Anna may start to get to a point where she's declining more. She's not able to do as much. She's spending more time at home and feeling lonely. Her family's trying to come in and help a little bit more. She lets the hospice team know, and they're able to send a volunteer out. And this volunteer can come and spend time with Anna. They may talk about her life. The volunteer may help with a few little things around the house, maybe prep a little bit of maybe some lunch for her. But it gives her some socialization and extra support so that her family can go do their errands and take care of themselves. It's like I tell everybody that you can't optimally take care of someone unless you're taking care of yourself. So this allows her caregivers to take care of themselves as well. As her condition continues to decline, the team determines that we need to start doing a little bit more preparation. We are starting to enter into the final phase. And so the team's really going to help her family understand what to expect and to talk to Anna about what to expect in her final weeks to days, and kind of work some things into her plan of care so that the family's supportive. And eventually Anna does come to her final days, and she's able to pass peacefully at home, surrounded by her family, which was one of her wishes. And so really this is a very important thing to us, is that we make sure that we are helping any participant spend their final time on their terms, and really to work for the things that are important to them. So go to next slide. And again, we have a wonderful bereavement program. The nice thing with Banner Hospice, which I'm gonna put out there, not as a selling point, but for anyone who has lost somebody, regardless of circumstances, our bereavement program is open to the community. There is no cost involved. If you or someone you know may be having a hard time with the loss of someone close to them, you let us know, and we are here to help you. We're really honored, again, to be able to offer bereavement services, especially in these very weird times with COVID. We've been able to do some teleconsults and via the computer or via the phone, especially for those who are not able to get out, or who are worried about any sort of if they're worried about catching COVID. So we do have other modalities as opposed to just face-to-face. So if you or anyone you know could benefit from bereavement services, please let us know. We're here for you. With our bereavement offerings, there's a lot of we are going to, our bereavement staff is going to check in with you. They're going to develop a bereavement care plan for each person that they come into contact with. We do give a couple one-to-one phone calls for support, and then referral assistance for long-term or professional counseling if it's felt that may be helpful. We do have bereavement groups, which are another thing for people to come together and share their experiences of love and loss, and find support among each other. We do have a grief recovery program, which is a one-on-one online program. It's limited, it's not indefinite, but we do have certified grief recovery specialists to help people through the very hard times. We have a memorial garden that we just opened. It's for everybody who's lost someone to come, and a special place just really for you to kind of sit and reflect, or for the family to kind of come together and remember somebody. We also have days of celebration. We have butterfly releases, special things that we have, for the participants and their families, to honor those people who've meant so much to us. So we have those, and we do have a contact information for that as well. I think one of the biggest honors that we have is to serve those who have served this country. And we are a Tier 4 participant in the We Honor Veterans program. This is a national program that is a joint program between the National Hospice and Palliative Care Organization and the Department of Veterans Affairs. There's training, all the staff, myself included, we all go through a particular type of training so that we can provide kind of a specialized care to our veterans, and that they're in our community. Some of the components are that we really focus on some respectful inquiry. If someone wants to talk about their military service, we're going to be very respectful about asking questions and discussing that. We're going to listen. I know that some people had amazing military experiences, that it was a once in a lifetime thing, that it's a point of pride, or a source of it's very important to who they are. There are other individuals who came back from combat that may not have had as positive of a return. And so it's our goal to just compassionately listen and to hear what our veterans are telling us about their service time. And really, we are very grateful, and we want to acknowledge our veterans and their service to our country, and for the losses they had, and the things that they have sacrificed for us, if they want, and that's a big thing. So we do have pinning ceremonies depending on which branch of the military you are in, or that your loved one was in. It's a very honoring, it's very serious, and just a very respectful way for us to honor our veterans, who mean a lot to us. In addition, we will sometimes, if someone wants to kind of do some guidance through life stories, if people want to talk about their life stories and their service, and really to help people move towards a peaceful ending to their story. So we have some quotes here in their own words from family members that you kind of support what hospice in general really can provide for anyone who's caring for a loved one. So the first one, I cared for both parents while they were on hospice, and they died within 4 months of each other. It was the worst time of my life, but your team made it bearable, and so kind and caring to all of us. Thank you. Really, it's a lot of, we really strive for being the caring, loving staff that supports these families. And so this sort of feedback means a lot to us. So, and again, I think it's like Joyce said, I don't think I've ever heard anybody ever say, darn it, we enrolled too quickly. It is a lot of, wow, we wish we kind of would have known about this sooner. So next slide. Again, just to kind of, a little plug for what we can do. Really, our philosophy of care provides specialized healthcare for people nearing the end of their lives. We're an entity, it's a comprehensive high quality hospice and end-of-life service. We're committed to compassion and excellence in care, and serving thousands of patients and families each year. Again, I always view it as an honor and a privilege to help walk this final road with anyone as they come to the end of their life, and to walk it with their families. And so again, our goal is just to be as compassionate and as supportive to you and care for your loved ones. So I think that we're going to end on this. It's a lovely quote that Joyce found for us that says, "You matter because you are you, and you matter to the end of your life. We will do all we can, not only to help you die peacefully, but also to live until you die," which is a lovely quote. So we'll open it up if anybody has questions or would like to discuss anything in further detail.
Wow. just your program is really, really, really a wonderful program. And I will tell you that I've been doing this for moderating these in a number of communities that we serve. And Joyce, you and Cara did as thorough a job as I've seen, extraordinarily comprehensive. So I will ask some questions, but I will tell you that we could feel the passion that your team has for doing this work that is so important to families when they face these situations, and every family faces them. So it was just really helpful to feel that passion and to feel the care that your organization obviously has developed as you provide this kind of care. One of the questions I had was, so what if somebody is too young for Medicare and is no longer working? They got sick, they're not working, they had to leave their job. What do they do about payment, and how does that work?
So Dr. Johnson, I'll go ahead and take this one. So if a patient does not have Medicare, oftentimes a commercial benefit will cover the cost of hospice care.
What does commercial benefits mean?
So if you have like a Blue Cross Blue Shield or
what if they don't have any insurance?
Okay, so we do not turn anyone away for the lack of ability to pay for services. So if we have a patient that needs our care and has no means to pay for it, we are lucky to have supporters for us to provide care at no cost.
So you have a foundation that
do have a foundation, and yes, we have a foundation, and I will tell you that we use more of those dollars than we collect every year. So just putting a plug in, there
continue to donate.
Yes, please donate. We have a lot of people in all of our communities that find themselves in that situation. They're too ill to work. They don't have insurance, but that does not prevent us from coming in and providing care for them.
And did you see an increase in need during the COVID pandemic, and that still continues?
Absolutely. We saw a lot of people that weren't working, that maybe previously had been seeking aggressive treatment and now have made the decision, either by lack of insurance or by just where they're at in their life, that it was time to come on to hospice care. So we did see an increase, especially in our charity care request.
So what do you say to a caregiver that's trying to convince their loved one that they really should think about hospice care, but the loved one just feels like, hey, I'm giving up if I do that?
Yeah.
I've got to believe that's got to be pretty common.
It is.
So what do you say to them, and what recommendations would you have to individuals who might be facing that's maybe listening in today?
So I'll give you my answer, and then I would love for Dr. Johnson to jump in on this as well. So, whenever I meet with a caregiver, the first thing I say is thank you, right? Thank you for taking on that role. Mm-hmm. What I often find with people when they're trying to make that decision is, once we can provide them with the facts and let them know that seeking hospice care is not giving up. It really is about enhancing quality of life. And so, oftentimes when we can have that discussion, they see it in a different light. But there certainly is this misnomer out there that hospice is about dying, and it really isn't. I mean, hospice is about living your highest quality of life until you die, and we're all going to die at some point. But it's really focusing our efforts on just maintaining that amazing quality of life until the end. Dr. Johnson, do you want to add?
Yeah, and this is a lot more common than you would realize. It's usually one of two ways. It's either the individual wants to look into hospice, but maybe their loved ones are like, no, you can't give up yet. That's surrendering. And vice versa, where you have the family saying it may be time, with the individual saying, no, I'm not ready yet. I think that ultimately you just need to have a really good discussion about kind of where we're at, what our expectations are kind of with ongoing treatment. I believe that, first off, you can't force anybody to do anything they don't want to do. And some people just are not ready. There are reasons that in the medical community where our terminology is very aggressive. We are going to fight this. We're going to defeat it. We're going to do this. We talk in very aggressive terms when we're treating illnesses. And so I think a lot of people feel they need to keep that up until the end. And sometimes the will to keep going is really strong, but our bodies, our bodies aren't built to last forever. And there comes a point when we can want to keep trying as long as we can, but the body just can't do it, and the body's exhausted. And so really, I think the big thing is just kind of going back and addressing kind of where we're at. This is how this would look if we continue to do treatment. This is how this would look if we continue maybe to do like a palliative care. This is what this would look like if we did hospice, and really to find out what's the most important thing to each individual. What are their fears? And really just kind of come together as a plan. And sometimes maybe it is time to start looking at hospice. But if someone's not ready, they're not ready. And that's okay. That's okay. That's one of the wonderful things is that we all get to be a part of our decision making, and we all get to be a part of our care team and make those decisions. And so really it's just kind of, laying out, here's the different things, what's most important to you. And if you're not ready, then you're not ready. It's okay. But you call us when you are. There's nothing wrong with going on. So everybody it's just everybody's individual, and it's really just having a lot of discussions to come down to what's most important to you or the person. Everybody's different.
Appreciate that answer. I know that nausea and appetite issues are often associated with things like cancer and other end-of-life diseases. And I know families are using gummies and lollipops with marijuana in them to help patients. Now, you obviously can't do that, but do you support the families that are doing it?
Joyce, do I get to give my honest opinion on this?
Yes, you can.
We want your honest opinion.
No, so this is so as a physician, so you're number one, you are correct. As a hospice, we do, any hospice there, Medicare is not going to let us cover the cost of those gummies, those lollies, things like that. Okay. So I don't get to prescribe them to individuals, but if a family's picking them up for someone, if they are helping, I need to know about it, because I need to know because I'm kind of always reviewing the med list. What else can we be doing to help, on and on. It is legal in the state of Colorado. Mm-hmm. I'm not going to stop you. You're grown up, your family's a grown up. If it's helping, we want you doing well. I just need to know about it so that we can kind of put it into someone's care plan, so that we're not doing anything that's going to interact or cause more problems. So
right, and the reason I asked that question is I've seen it in my own friends, family members who have passed, and they've used, particularly for appetite improvement, it extraordinarily helpful. So I was just curious about that. Like I said, your presentation was so thorough, and your organization is so passionate. I just can't thank you enough for taking the time to present to our listeners and to people who will see this later on. And we wish you well, and thank you so much. With the work you're doing. So thank you.
Thank you.
Thank you for having us.
Thank you. Have a wonderful day.